In this video, we would like to speak about obesity definition, its complications, and obesity treatment, including lifestyle modifications, bariatric interventions, and particularly bariatric surgeries.
Obesity in adults. Hello everyone, welcome to the Lancet Summary YouTube channel. Dr. Salamati, could you please define obesity?
The World Health Organization defines obesity as abnormal or excessive fat accumulation in the body. There are a host of different indicators for calculating obesity, and one of them is BMI or body mass index. For evaluating BMI, we have to divide weight per kilogram by height squared per meter. If somebody has BMI equals or more than 30, we can consider them as obese, and we should pay attention that for non-white people the figure is a little different. I mean, for them we should consider less than 30.
And what are the complications of obesity?
At the moment, about 890 million people across the globe are obese, and the figure is about 13% of the world population. Experts evaluate that by 2030, the number will increase to more than 1 billion people. In other words, in that time, about 18% of people will be obese. We can categorize obesity complications into 3 different groups, including metabolic, mechanical, and psychological. Also, people with obesity have stigma and discrimination in their societies. As a result, these people have decreased quality of lives and social well-being.
Would you please name the most important metabolic, mechanical, and psychological complications of obesity?
For sure. The most important metabolic complications are type 2 diabetes, fatty liver, high blood cholesterol, chronic kidney diseases, and cardiovascular diseases. For mechanical consequences, we can name arthrosis, gastric reflux, respiratory failure, urinary incontinence, and intertrigo. And in psychological complications, we have anxiety, depression, and eating disorders. More importantly, the association between obesity and excess mortality has been well documented scientifically.
And please explain about obesity treatments a little bit.
To be more precise, the first step for obesity treatment is lifestyle changes, including eating pattern modifications, increasing physical activities, stress management, and improving sleep quality. If you reach the goals, you should continue the treatment for a long time. And if you can't reach them, you should change and you should go to other interventions, including medications, bariatric surgeries, and endoscopic procedures.
Dr. Talebpour, could you please explain about bariatric metabolic surgeries for obesity treatment?
As you know, the experience of bariatric surgery is more than 70 years history, and we can claim that the more effective method of bariatric treatment is actually bariatric metabolic surgery. And if I want to explain about the different techniques, I have to subdivide techniques into 2 important groups. The first group is named as restrictive operations, which include operations that just decrease the volume of the gastric lumen. The most common operation in this field nowadays is sleeve gastrectomy, which we remove about 80 to 85% of the stomach vertically by laparoscopic surgery, mainly now. And by this technique, you can say that by change of hormonal secretion in the body, actually the appetite of the patient decrease, mainly due to intraluminal pressure of the stomach, due to change of anatomy which performed by this technique. Other techniques in this group can be named as gastric plication, as gastric banding, and other things, which now the rate of this operation has decreased in compared to sleeve gastrectomy, and we can say that the most common operation in the world, including the East countries and third countries, are in between different operations is a sleeve gastrectomy. Mainly because in the long-term period we have not any need to follow and to make any medication for these cases. And the second important groups of the bariatric and metabolic surgeries are malabsorptive operations, which focus on the absorption of materials in the small intestine. In this field, we can claim that there are a lot of operations with different advantages and disadvantages, and we can say that we have not any ideal operation in this field. But the most common operation in this field is actually mixed operations, which included restrictive and malabsorptive operations, and gastric bypass, classic gastric bypass, Roux-en-Y gastric bypass is the most traditional operation in this field. Pure malabsorptive operation, which is the third group actually, are very rare and has just traditional experience. We, at the first of time of our operations about 30 years ago, we did ileojejunal bypass without any change in the stomach. And it is not accepted now, and we claim that this pure malabsorptive operations can induce cirrhosis of the liver, and it's actually thrown away.
And would you please elaborate on the effectiveness of bariatric metabolic surgeries and the risk of regain obesity after them?
Actually, we explain about the effectiveness of the operation based on body excessive weight loss, which is calculated by the traditional forms. And if we find out the excessive weight of each patient, and during the 1 year of the operation calculate the percentages of excessive weight loss, we can say that in restrictive operation commonly about 60% of excessive weight loss performed. And in mixed operation is up to 70% each year, at the first year. And during the time in restrictive operation, the most problem is dilation of the narrowed stomach by our operation. Imagine about the volume of the stomach of the baby. At first, it is about 50 cc, and after 4 years, it changed to 200 cc. This means that the stomach can be dilated little by eating and drinking materials. So after our operation, after restrictive operations, where the first stomach volume is about 50 cc, we can guess that after about 4 years, it has changed to 200 cc's. And it's equal for the patients who has not any change of lifestyle and eat and drink based on the appetite of their condition. We can see that regain occurs after about 4 to 5 years after operation. So the risk of regain is common after restrictive operations, and we can claim that after about 10 years of restrictive operation, about 35% of cases complain of regain. In compared to mixed operation like gastric bypass, the effectiveness of the operation is about 70% at the first year, and the risk of regain after 10 years of operation in mini gastric bypass, for example, is less than 7%, and in Roux-en-Y gastric bypass is about 15%. And the main cases of these groups are cases which drink or eat little by little during the time of their life without any stopping.
Dr. Salamati, can you please explain about the adverse effects of weight loss?
Although people with obesity can have many advantages from treatment of obesity, there are a couple of harmful effects of treatment. For instance, one of them is gallstone diseases. You know that people with treatment can have some rapid changes in their bile saturation in the liver, and it can cause special crystals and cause some gallstone diseases. Furthermore, bariatric surgeries can decrease musculoskeletal mass such as sarcopenia, bone mineral loss, and produce some fractures. Although people with obesity can benefit from the treatment with psychological issues, there are a couple of different problems such as body dysmorphia, eating disorders, and depression. Also, some people, because of the eating pattern changes, can have some nutritional deficiencies.
Dr. Talebpour, could you please explain about endoscopic procedures for obesity treatments?
As you know, about 5% of general population are candidate of bariatric metabolic surgery. But actually we can see that just 2% of cases accept to do operation. Why? One of the reasons that they deny to do operation is just operation, just incision in the body, and some problems regarding to other operations which usually perform. So endoscopic method is attractive for a lot of patients to do some works, to do weight loss without any classic operations, making any incision in the body and something like this. So the idea of endoscopic procedures, although it's very, very primitive, but is very attractive. And in the world, there are a lot of people, especially rich people, which do like to do this way of operation because prevent any incision in the body. But the effectiveness of endoscopic surgery with routine methods, which is used nowadays, is very weak because it's impossible to make restrictive operations like the traditional restrictive operation like sleeve gastrectomy, and it's impossible to perform mixed operation by endoscopic surgery. We can say that just about 50% of the volume of stomach decreased by endoscopic methods as a primary bariatric metabolic surgery. It's very good in the future with new instruments, new experience to perform endoscopic, restrictive, effective operations in the future. Maybe the protocol of operation, restrictive operation, changed to just endoscopic methods. But another attractive effectiveness of endoscopic surgery is to solve some problems of the bariatric and metabolic surgeries, including, for example, leakage of the sleeve gastrectomy, which by endoscopic methods, which we can close the site of leak, we can put a stent and prevent leakage. We can use the pigtail at the space of the orifice of the leakage and change the pathway of materials from outside to inside of the lumen, and by this way the problem can be solved very quickly. Or, for example, in cases of regain after gastric bypass, maybe the risk of it is due to enlargement of the pouch or enlargement of the anastomotic side. And by endoscopy method, you can narrow the lumen, or you can make 2 or 3 sutures at the site of anastomosis, and the length of anastomosis change to narrowing form. And by this very simple method, you can change the risk of regain to a normal weight again. And I can say that this second form of operation by endoscopic method is very effective, very usual, and very helpful for bariatric and metabolic surgeons, because a lot of problems of these operations can be solved by endoscopic method without any re-operation, without any risk of general anesthesia and something like this for patients and for doctors. The effectiveness of endoscopic surgery as a primary technique for bariatric and metabolic surgery is under question. But in the future, maybe as other revolutions of the methods of the surgery, maybe the future of the bariatric and metabolic surgery be in the endoscopic way.
Dr. Salamati, in the end, what is your conclusion overall?
All in all, obesity is a growing epidemic in the world. For the treatment of the obesity, we should change our lifestyles, including eating pattern modifications, increasing physical activities, stress management, and improving sleep quality. In next step, if we don't reach our goals, we should have other interventions, including medications and bariatric surgeries. Meanwhile, all of us should follow some preventing strategies for obesity.
Thank you for your thorough explanations. In this video, we discussed an article called Obesity in Adults that was recently published in the Lancet journal in September 2024. Don't forget to like this video, leave your comments below, and subscribe to our channel.